Hi, everyone. I'm Lauren Abdulmajid, a student at the University of Illinois at Chicago College of Medicine, and I'm your FMIG National Network Coordinator. We're really honored to have Dr. Wanda Filer with us today for this episode of Family Medicine on Air. Dr. Filer is the current president of the AAFP, as well as a practicing family physician in York, Pennsylvania. For today's episode, Dr. Filer is going to share with us some advice and wisdom surrounding what medical students need to know about gun violence. Dr. Filer, thanks so much for being with us today, and I'll go ahead and turn it over to you.
Well, thank you, Lauren. It's my pleasure to be here, and I want to welcome all the family medicine medical students because you're a very important part of the American Academy. Last Friday, I had the opportunity to go down to Charleston, South Carolina, and many people may remember that back in June of 2015, there was a racially motivated mass shooting at Mother Emanuel AME Church in Charleston, and the murderer came in and killed 9 members of a congregation down in the fellowship hall. So it was a very poignant experience for me to go down, and they were doing a community conversation around reducing or preventing gun violence. And they had over 507 attendees. But my privilege was to sit on the healthcare panel along with Dr. Daniel Webster, who is probably the preeminent researcher in the world at Johns Hopkins School of Public Health around reducing gun violence. Also with Dr. Wayne Riley, who's the president of the American College of Physicians. And then there were 2 physicians who were from the Charleston area who are put together a coalition that's got multiple stakeholders: education, public health, the advocacy community, the faith community, and general citizens in Charleston. And that organization is called Gun Sense SC for South Carolina. We started the day in the fellowship hall downstairs where this violence had happened. It was an incredibly powerful, emotional day. They're just a few months out from this tragedy. It makes it incredibly real. You know, I've taken care of patients who are gun violence victims, sometimes survivors and sometimes not. I've done the stabilization from them from a medical end, but a lot of times we forget that there's family members, that there are loved ones, that there are community members that are left behind. And as a family physician, I take care of those people quite frequently. I got involved in the issue around violence about 25 years ago. And for me, a lot of the issue started around interpersonal violence, what some people know as domestic violence. And that happened because I had been called in one Saturday to see a new baby in the nursery. And this baby, beautiful baby. And I talked to mom about all those things back then that I had been taught to talk to new mothers about: breastfeeding, car seats, immunizations. I didn't know anything about talking to that mom about safety and her safety and violence. And when that mother was about maybe 3 months postpartum, the mother's 2 other children who were toddlers, her own mother and her own mother had a 2-year-old, were all murdered by the husband / father / uncle, who now sits on death row in Pennsylvania where I live. And I vividly remember watching my partner sobbing into her dictaphone, which is how we did things back then, but sobbing with these closing notes in the computer about this family. And she turned around and she said to me, you know, this is a family I thought could make a difference. And Paul stopped and fed the baby in the midst of this massacre. So the baby is the only one who survived. And I will tell you that for me, this family has made a huge difference. It took me on a personal and professional journey. It took me on a journey as a family physician to say, what could I have done differently? Is there something I should have known? And back then, medical students weren't taught much, and residents weren't taught much about violence. We weren't taught about the opportunities to ask questions, the threat assessment, the helping with safety planning. We also didn't know how to leverage community resources. And I'm proud to tell you today that I think a lot of that has changed, although there's still a lot more work to do. in family medicine, we call ourselves family and community medicine. And so it is my responsibility not only to take care of that patient in front of me, which is a tremendous privilege, but I often have relationships across generations, across extended family, and also out into the community. So I've had the privilege over the last 25 years to sit on the National Domestic Violence Standards Task Force, to sit on my county fatality review team, where we look at violence-related deaths and assess what are the systemic issues that we could be doing differently. And that's allowed me to sit next to judges. It's allowed me to sit next to law enforcement, public health community, and come together and be part of that community solution. I very much love that. I love the feeling that from a tragedy can spring hope. And I think the family physicians have an integral part of that. We get a view of humanity and of our communities. Probably only close second to that might be clergy. You get a chance to see people at their highest highs and their lowest lows. And so violence is something, unfortunately, which we've seen in Colorado Springs and Aurora and San Bernardino, way too many communities in this country. And what I learned last week, in addition to seeing the strength of the people of Charleston and the commitment to coming together and the willingness of the South Carolina Academy to step forward and be a partner in this work, is I also learned that we have 11,000 murders, gun violence related murders in this country every year, 11,000 people, and that in the last 4 years in this country, there have been more gun violence deaths than we've had in Vietnam, Korea, Iraq, and Afghanistan combined. And so this is clearly a public health issue. It's clearly something that is killing our population. It's the leading cause of death for black males between 15 and 24, second leading cause in the next cohort of young men. And we have an opportunity as family physicians to start talking to families about violence, about gun safety, without necessarily stepping on Second Amendment rights. And that's a big issue in this country. That's a big argument. It's a very divisive political issue. And as president of the American Academy, my 121,000 members are across the political spectrum. So I'm trying to be sensitive to all sides of this equation, but recognize that as a family physician, it's my job to save a life. And I believe family physicians, probably better than most disciplines in medicine, have the opportunity to have those conversations and think about prevention. If you think about gun violence in many ways is a social contagion. Not unlike what we think about with HIV. Violence in general is a social contagion, and the agent of injury in this case is a gun. And so how do we help to figure out, for those people who have vulnerabilities around potential guns, how do we help them to lower that vulnerability, talking about safe firearm use, talking about protecting children, protecting your family. There are things that we do as family physicians every day as part of our pediatric visits in anticipatory guidance. When we have conversations, I talk about car seats, I talk about immunizations, we talk about child-proofing your home, we talk about smoke detectors, seat belts. Gun violence is another one of those opportunities to make that a standard operating procedure when we're doing well child care. But also recognizing that, I have patients who've lost a loved one to guns, whether it be by that person's own hand or it's someone else's hand, and helping that person to find a sense of wholeness again. I cannot replace what they've lost, but I can help them know that I hear them and that I'm empathetic. And if they start to show stigmata of PTSD, for instance, or depression or anxiety, what are the treatment options that we might have? And that might be cognitive behavioral therapy. It might be a referral to a local agency to help them get some support, or a behaviorist in my own practice. I sometimes will do the counseling myself, depending on the patient's preferences. It might be in cohort with some conjunction, I should say, with some medical therapy. But there are a lot of tricks that family medicine has taught. That a lot of things that you can deploy as as a primary care physician to help your patients get to a better sense of health and healing and wholeness. And again, you can't undo that damage, but there's a public health approach we can take. There's also, I think, an individual approach that we take, and that's really where the double benefit of family and community medicine really comes to bear. So I'm going to stop there, Lauren, and let you take it from here.
Okay, wonderful. Thank you so much, Dr. Freiler. This is definitely an issue that medical students are very concerned about as well. And I actually have a few questions from some medical students from around the country that they would like to ask you. The first question is, what is the best way to counsel patients who own guns about gun safety? As well as how should we be advising them to teach their children about gun safety?
Well, that's a great series of questions, Lauren. One of the things I think that's important is that medical students know that talking to families with children about guns is very important. And what I usually say to them is, do you have a weapon in the home? Are there any guns around your home? And if the answer is yes, you say to them, well, I'd like you to know that I would advise you to keep the guns unloaded, make sure they're locked away in a safe, in a locked cabinet, and make sure that the ammunition is stored in a separate location. And so again, the issues are, do you have a weapon in the home? And if you do, make sure they're separate from the ammunition and that the place where they're stored is locked. Sometimes I'll also encourage them, if the children are starting to get a little bit older, if they want to teach their children. I'm in Pennsylvania. Hunting is a very popular thing. Let's make sure your children take a gun safety course, and maybe you want to go back and take a refresher, take your children with you and role models a safer behavior. So that would be one. I will tell you, I think it's important for students to know that there are several states, Florida is probably the biggest offender in this, where right now physicians are not allowed to ask about guns in the home. And it's actually been upheld once in the court system. I think most of us are pretty appalled by that. There are at least several other states that are entertaining that idea, and I think there are restrictions on perhaps 4 states. So it's important to know where you're located and what the legality is in your own state. I will tell you that the medical community and even the American Bar Association is working with us. The American Bar Association, when those individuals were with me in Charleston last week, including the president of the American Bar Association, they're appalled with this legislation. They're appalled that this is the circumstance. And many of us believe that this is an infringement on physicians' First Amendment rights. So we are working very hard to see that those ill-advised and potentially life-threatening laws are overturned. But right now, for medical students, I've got to advise you, make sure you know where you're working, talk to your attending in the area and find out what restrictions, if any, might be there.
Great. So we actually have a couple minutes left. I think we can have time for one more question here. So what can you tell us about the public health measures you're aware of that exist surrounding gun control and gun violence? And also specifically, can you tell us a little bit about the ACE study?
Sure. The one project that I am still in the process of learning a lot about is called Cure Violence, C-U-R-E. And I learned about them last week in Charleston. It is a public health methodology to kind of take that approach of a social contagion, similar to what we did years ago around tobacco. We saw HIV come, out there and needed a public health model, hopefully to try to keep it and get it under control. Same thing around gun violence. And so they have, I have that in a blog I recently posted around gun violence and about my experience, and they've reached out to us through Twitter. So we're just going to open a conversation to learn more about Cure Violence. So I would ask your fellow students to stay tuned. The ACE study is the Adverse Childhood Experiences Study. It's a CDC kind of funded and housed study that was started about 25 years ago in California, and they looked at 17,000 people, and these were all people who had insurance. They were a middle class demographic, roughly half and half, male and female. Most of them had some degree of college education, and they asked these people to self-report their history of traumatic childhood experiences, and they ranked these people. For every one that these individuals said yes to, they got 1 point. And they tracked these people, these 17,000 people, over 20 years now. And what they found is that if you have an ACE score, things, for instance, watching your mother being beaten, or having a loved one who was incarcerated, or being sexually assaulted, or drug abuse in the home, if your ACE score got to 6 or over, your life expectancy dropped by 20 years. There's also a marked increase in multiple other comorbidities, multiple other health problems: ischemic heart disease, autoimmune disorders, teen pregnancy, eating disorders, anxiety, depression, suicide, and violence, and becoming either the victim or the perpetrator of violence. So it's very clear to those of us who are familiar with the ACE study that this particular experience from children seeing violence, or not being treated appropriately and nurtured, really has a long-term implication and may be the defining issue in American healthcare these days. So I would encourage the students to go on and look at the ACE study, get a sense of the ACE score. And there's also a lot of work around that now, around resiliency and how you help people who've been victims of trauma to better heal. And so I think there's a lot of things that we've got that are starting to come forward as a result of this conversation. It's a very politically divisive conversation to talk about gun violence in this country, but we need to have it, because this country is not as healthy as it needs to be, and we're all going to pay a price if we suffer in silence.
Great. Thank you so much, Dr. Filer, for shedding some light on this issue. I know this is definitely something that medical students have on their minds right now, as does the rest of the nation. So thank you so much for sharing those words of wisdom with us. And thank you, everyone, for tuning in. And we hope to see you on our next episode of Family Medicine on Air.